Hey everyone, welcome back. I know nursing school's got to be keeping you crazy busy, so we're going to jump right into it.
Sounds good to me.
Okay, so today's deep dive, we're talking all about pregnancy.
Okay.
But we're not focusing on those picture-perfect, healthy mom and baby scenarios.
Right.
We're going a little bit deeper. We're talking about risk factors, the complex cases, the stuff that as nurses, you really need to know to provide excellent care. It's the stuff that really tests your skills.
Absolutely.
Yeah.
And being prepared for that is really key.
Yeah, so we're really excited to dive into this with you today. We have an expert here who can help us break it all down, connect the dots between all these conditions we're going to be talking about and how pregnancy kind of throws a wrench into things.
It definitely does. It adds a whole new layer of complexity, that's for sure.
Totally. So why don't we just jump right in?
Let's do it.
Okay, so let's start with a condition that honestly we're seeing more and more of these days, even outside of pregnancy, and that's diabetes.
Mm-hmm.
Now, I know you guys know the basics of diabetes, but here's a statistic that I think is pretty striking. By 2030, projections show 1 in 3 adults in the U.S. could have diabetes.
Wow, that's a lot.
I know, right? And that has huge implications when we're thinking about pregnant women.
Absolutely. Because pregnancy itself actually affects insulin resistance. It naturally increases, so it makes blood sugar control way more difficult for those women who already have diabetes.
Okay.
And it can also lead to gestational diabetes, for women who didn't have it before.
Right.
And the thing is that the consequences can be pretty serious.
Yeah.
We're talking birth defects for the baby, long-term problems like eye and kidney damage for the mother.
Yeah, that's a really good point you brought up about long-term health, because it's not just about, getting through the pregnancy, right? We need to think about the effects after for both mom and baby.
Exactly. It's not just a 9-month thing.
Totally. So, maybe just for folks who need a quick refresh, can you kind of break down the different types of diabetes that we might see in our pregnant patients?
Absolutely. So we've got type 1 diabetes, which is where the body doesn't produce insulin at all. And then there's type 2, which, is something that kind of develops over time.
Mm-hmm.
And then we have gestational diabetes, which is the one that emerges specifically during pregnancy.
Right.
And typically that resolves after the baby's born.
Okay.
Management approaches will vary depending on what type we're dealing with,
Mm-hmm.
but the overall goal is always blood sugar control.
Makes sense. And I remember from the material we were looking at, preconception counseling, it talked about that a lot for women with diabetes.
Oh, yeah. It's so important.
Why is that so crucial?
So imagine this, right? If a woman can get her blood sugar in, the optimal range before she even gets pregnant,
Okay.
it drastically reduces the risk of complications.
I see.
For both her and the baby.
So it's like setting the stage.
Yeah, exactly. It's so much easier to manage everything from a stable starting point rather than playing catch up.
Right. Totally. It's about being proactive, not reactive.
Exactly.
Okay, cool. So let's switch gears a little bit, talk about another health issue that honestly often gets overlooked,
Okay.
especially in women, and that's heart conditions.
Mm-hmm.
So it's easy to think of heart disease as like a man's problem, but the truth is it's the leading cause of death for women in the U.S.
Yeah. And pregnancy, like we were saying before, can really complicate things.
In what way?
Well, think about it. The cardiovascular system is already working so hard during pregnancy, right?
Yeah.
It's pumping all that extra blood, so that added strain, it can really worsen existing heart conditions.
Oh, okay.
Or even unmask underlying issues that weren't really noticeable before.
So it's like pregnancy is almost like a stress test for the heart.
In a way, yeah. It can definitely reveal vulnerabilities.
Wow, okay. Now, I was also curious about that WHO risk classification system for heart conditions during pregnancy, because, as nurses, we see that a lot.
Yeah, that's a good one.
How does that system actually help us in practice?
So it's not so much about memorizing the specific 4 classes, 1 through 4.
Okay.
It's more about understanding how that classification guides our actions.
I see.
So it helps us determine what level of care a woman needs, if we need to make decisions about delivery methods, things like that.
Okay.
It really helps us ensure the best possible outcomes.
So like a roadmap, almost.
Exactly.
Okay, that makes sense. Now, I'm always curious about specific examples.
Yeah.
So let's say we have a pregnant patient with mitral valve stenosis.
Okay.
So how does pregnancy impact that specific condition, and what should we as nurses be aware of?
So mitral valve stenosis, it's basically a narrowing of the heart valve.
Okay.
And it restricts blood flow. So now add pregnancy to that. Pregnancy increases blood volume.
Right.
So all that extra blood, it can really overload that already narrowed valve.
Oh, wow.
And that can lead to, fluid buildup in the lungs, breathing difficulties.
Yeah.
So careful medication management becomes really, really crucial.
Yeah, so it's all about kind of managing the heart condition, but also supporting the pregnancy at the same time.
Exactly. It's a delicate dance.
Totally. Okay. Well, let's move on to another issue that we see pretty often, and that's respiratory challenges. I mean, can you imagine being like a pregnant teenager, already anxious about everything, and suddenly you're struggling to breathe because of asthma?
Oh, absolutely. And asthma during pregnancy can be a lot to manage.
Right.
Because, it impacts the mom's oxygen levels, but it can also impact the baby's development.
Okay.
If you have severe asthma attacks, that can actually lead to premature birth or, in very, very rare cases, even stillbirth.
Gosh, that's scary.
Yeah.
And I also remember reading that asthma can behave really unpredictably during pregnancy.
Mm-hmm.
Oh, yeah. It's different for everyone.
Like some women will actually get better and some get worse.
Exactly.
So what's like the main thing that nurses should know, like the takeaway here?
I think the biggest thing is just to remember that you can't assume anything.
Okay.
So close monitoring is really, really important, and so is patient education.
Mm-hmm.
We want to make sure women know what their asthma triggers are, that they're managing their medications properly, and that they know when to seek help if things start to feel off.
Right. Yeah, recognizing those signs and symptoms.
Exactly.
Okay, great. Well, let's switch gears again, talk about anemia.
Okay.
And, it's more than just feeling tired.
Oh, it is. Anemia is actually a symptom, not a disease itself.
Okay.
So in pregnancy, it often signals iron deficiency.
Okay.
And iron deficiency anemia actually affects a huge percentage of pregnancies. Because think about it, the mother's blood volume is increasing dramatically.
Yeah.
The fetus needs iron to grow. And, her body is just working so hard to make all these red blood cells.
So the demand is just huge.
Exactly. And that can really deplete her iron stores.
So it's not just fatigue. Like there are serious consequences, right, if it's not addressed.
There are. You can have increased risk of preterm delivery, even developmental issues for the baby if it gets severe enough.
So it's definitely something to take seriously.
Absolutely.
Now, iron deficiency is common, but it's not the only type of anemia, right?
Mm-hmm.
What about those genetic conditions like sickle cell anemia or thalassemia?
Yeah, those are tricky ones.
What kind of challenges do those bring to the table during pregnancy?
So those affect hemoglobin production.
Okay.
Which is crucial, obviously, for oxygen transport.
Right.
Pregnancy is already putting stress on that circulatory system.
Yeah.
So, those conditions can really lead to complications. Severe pain episodes, infections, blood clots. Management often requires specialized care, potentially even blood transfusions.
Wow. Okay, so another reminder that we have to be aware of, like, the wide range of what our patients could be experiencing.
Yeah.
Okay, well, why don't we move on to something I find pretty fascinating, and that's autoimmune disorders. So, it's like the body attacking itself.
Yeah.
And actually, a surprising number of people who are affected by this are women of childbearing age.
That's right. And autoimmune disorders can be, localized.
Okay.
Like affecting one specific organ, or they can be systemic.
Oh, yeah.
Affecting like multiple systems. And pregnancy kind of throws a wrench into it all because, those hormonal shifts
Right.
and the demands of growing a human being can actually trigger flare-ups
Oh, wow.
or alter how the disease behaves.
So let's narrow it down, talk about a few specific conditions that are really relevant to pregnancy. Let's start with lupus, or SLE. Can you give us like a quick breakdown?
Sure. Lupus is a chronic autoimmune disease. It's notorious for being unpredictable. It can target different organs, causing inflammation and damage. And you get those notorious lupus flares, which are, they're unpredictable.
So during pregnancy, how does that work?
Well, those flares can lead to some serious complications, like preeclampsia, preterm birth, even miscarriage. So careful management is really, really important.
Yeah, it sounds like it. Okay, well, next up, multiple sclerosis, or MS. So this one affects the central nervous system, right?
It does. And with MS, the immune system attacks the covering of nerve fibers.
Okay.
And that leads to a bunch of different neurological symptoms.
Right.
Now, here's the interesting thing. Pregnancy actually often leads to fewer MS relapses,
Oh, really?
probably because of the hormonal changes.
Interesting.
But there's an increased risk of relapse after the baby's born.
So almost like a temporary reprieve during pregnancy.
Yeah, sort of like a trade-off.
Wow.
Yeah.
Okay. Well, last but not least, rheumatoid arthritis, or RA. That primarily affects the joints, right?
Yeah, so RA involves this like painful joint inflammation.
And how does that play out during pregnancy?
The challenge with RA during pregnancy is really medication management,
Okay.
because some of those RA drugs can be harmful to the fetus.
Right, yeah.
So you have to find that balance between like controlling the mother's symptoms, but also protecting the baby's health.
Yeah. That's got to be tough.
It definitely can be.
Okay, well, let's move on to something that I think can be a little bit intimidating, and that's infections during pregnancy. Because I think there's this idea that pregnancy, like, weakens the immune system.
Yeah, people tend to think that. It's actually more nuanced than that, though.
Okay, how so?
So some parts of the immune system actually ramp up during pregnancy, to protect the baby.
Okay.
But others are slightly suppressed. So it does mean that pregnant women might be a bit more susceptible to certain infections.
Okay.
It doesn't mean that they're going to be constantly getting sick, though.
Okay, that's good. That's reassuring. So let's talk about some of those, like, high-yield infections, the ones that we're most likely to see as nurses, right?
Sounds good.
So what about cytomegalovirus, or CMV? That one seems to be a little bit sneaky.
It is. It is. CMV is tricky because it's often asymptomatic in adults.
Oh, wow.
So people don't even know they have it. But if a pregnant woman gets CMV for the first time,
Right.
it can have really devastating consequences for the baby.
Like what?
Things like hearing loss, vision problems, developmental delays.
Gosh, okay, so prevention is really key there.
Absolutely.
Well, another infection that I think really highlights the importance of vaccination is rubella.
Oh, yeah, German measles.
Mm-hmm.
That one is highly contagious, and if you get it during pregnancy, especially early on,
Yeah.
it can cause really serious birth effects.
Yeah, and that's why, that MMR vaccine is so important.
It is. Not only does it protect the person getting the vaccine, but it also prevents the spread,
Yeah.
So we're protecting future generations.
Okay, cool. Well, another virus that we want to talk about that can cause problems during pregnancy is genital herpes, or HSV.
Yeah, and HSV transmission during childbirth, that can cause some major complications for the newborn.
Okay.
Things like brain damage, even seizures.
Oh, gosh.
And the risk is highest when a woman has like an active outbreak during delivery.
Okay.
So that's when careful management comes in, antiviral medication, or potentially even a C-section.
Okay, so let's talk about hepatitis B.
Mm-hmm.
Now, all pregnant women are routinely screened for hepatitis B.
Right.
So why do we do that?
Well, so hepatitis B, it affects the liver, and it can be passed from mother to baby during childbirth.
Right.
But luckily, we've got a really effective vaccine.
Okay.
So routine screening just helps us make sure that if a mom is infected,
Yeah.
she gets the right treatment to lower the risk of passing it to her baby.
So it's all about prevention.
Absolutely. It's a perfect example of preventative care making a huge difference.
Right, yeah. Okay. Well, last one in this category, let's talk about Group B strep, or GBS. I feel like we see this one a lot in maternity care.
Oh, yeah. It's really common. So GBS is a bacteria that's often found in the vagina and rectum.
Okay.
And, most of the time it's harmless. But during childbirth, it can actually be passed to the baby.
Okay.
And it can lead to some really serious infections.
Oh, wow.
So that's why we screen for it late in pregnancy. And if a woman tests positive, we give her antibiotics during labor to prevent transmission.
So it's like a simple intervention
Exactly.
that can have huge positive impact.
Exactly.
Okay, so let's shift gears again a little bit. Talk about something that unfortunately still carries a lot of stigma, and that's HIV and pregnancy.
Yeah.
So I think it's really important that we approach this topic with a lot of sensitivity. While the diagnosis itself can be scary, HIV is not the death sentence it used to be.
Absolutely not.
Treatment has really, really advanced.
It really has. It's become a manageable chronic condition.
Yeah.
And with proper care, the risk of passing it from mother to baby is significantly reduced.
That's all about information.
Yeah.
Support, not judging.
Yeah.
What are some of the most important things for nurses to know about HIV and pregnancy?
Okay. Well, first and foremost, transmission. So HIV can only be spread through sexual contact, blood, or from mother to baby during pregnancy or childbirth.
Okay.
So understanding that can really help with dispelling myths and preventing transmission.
Right.
Then there's routine testing.
Okay.
The USPSTF recommends offering HIV testing to all pregnant women, no matter what their risk factors might be.
I see.
Because early detection allows for early intervention, which is key.
Yeah, okay, makes sense. What about antiretroviral therapy, or ART, in managing HIV during pregnancy?
That's the game changer. RT is so effective. Consistent use can suppress the virus to undetectable levels,
Right.
which drastically reduces the risk of passing it to the baby. We recommend RT for all pregnant women with HIV, and the baby also gets medication after birth as an added precaution.
Wow. Okay, so we've come a long way. Now, aside from the medical stuff, what about the psychosocial challenges that these women might be facing? Are there things that, as nurses, we should be particularly aware of?
Oh, absolutely. I mean, think about it. A new diagnosis like this, especially during pregnancy, can be emotionally overwhelming.
Right.
You've got fear, anxiety, potentially even social stigma.
Yeah.
So our role as nurses is to really provide that compassionate, non-judgmental care
Right.
and create a safe space where these women feel supported.
Right, and empowered to make those decisions.
Exactly.
Okay, cool. Well, now I'm thinking about, specific populations of pregnant women.
Okay.
Certain groups that might need a little extra attention and understanding from us as nurses. So let's start with pregnant adolescents.
Okay.
I think it's important to remember that while teen pregnancy rates have gone down, it's still a reality.
Oh, yeah, absolutely. And these pregnancies come with this whole extra layer of challenges, right? Not just the physical risks. We're talking social, emotional, even economic challenges.
Yeah, so what are some specific challenges that pregnant teens face, and how can we best support them?
I mean, imagine being a teenager, right? You're dealing with all the normal teenage stuff.
Yeah.
Hormonal changes, social pressures, and then you add pregnancy on top of that.
Right.
They might have to interrupt their education. They're more likely to face economic hardship.
Yeah.
And sometimes they're dealing with, really difficult family situations on top of everything.
Right.
So it's crucial to approach them with empathy, be non-judgmental, and really connect them with resources, prenatal care, educational programs, even social services if they need it.
It's about meeting them where they are, right?
Exactly.
Okay. Well, on the opposite end of the spectrum, we have women of advanced maternal age, and, that's a group that's steadily increasing as more women delay childbearing.
Yeah, and that's a good thing. Women are achieving their career goals, finding the right partner later in life.
Right.
But, there's that elephant in the room. Pregnancies over 35 do come with increased risks.
So what are some of those, and how can we manage them?
Well, think about it. Our bodies change as we age, right?
Yeah.
And our reproductive systems are no different. So women over 35, they're at higher risk for gestational diabetes, hypertension, preeclampsia,
Okay.
even a slightly higher risk of chromosomal abnormalities in the baby.
Gotcha.
So genetic counseling and testing become even more important. We need to monitor for complications more carefully, tailor our education and support to be age appropriate.
So it's all about that individualized care, right?
Exactly.
Meeting each patient where they are.
Absolutely.
Okay, great. Well, let's tackle a topic that honestly can be kind of tough to talk about, and that's substance abuse during pregnancy.
Right.
Because, it's something that affects every socioeconomic group. Pregnancy doesn't magically make it go away.
Nope, it definitely doesn't. And unfortunately, substance use during pregnancy is more common than many people realize.
Yeah, it's something we have to be ready to address. So why is it so hard to even talk about?
There's a lot of stigma around substance use.
Right.
And that stigma can actually prevent women from getting help or even admitting that they have a problem.
I see.
They might be scared of being judged, legal consequences. They might even be worried about losing custody of their child.
Yeah, that makes sense. So it's really important to create a safe and supportive environment.
Absolutely. Yeah. It's about building trust and rapport and letting these women know that we're there to help them, not judge them.
Right. Okay, so let's talk about the impact of some specific substances on pregnancy. Let's start with fetal alcohol spectrum disorder, or FASD.
Okay. FASD is one of those things that's just heartbreaking because it's entirely preventable.
Right.
But alcohol exposure during pregnancy can cause all sorts of problems for the child. Physical problems, cognitive problems, behavioral problems, and there's no cure.
So even small amounts of alcohol?
Even small amounts can have lasting consequences.
Wow. Okay, well, what about nicotine?
Oh, nicotine, that's a big one.
It is.
Sadly, smoking is still the biggest preventable cause of harm during pregnancy. It increases the risk of preterm birth, low birth weight, all kinds of respiratory problems for the baby.
And even cystides.
Yeah, and cystides, it's a long list.
Okay, well, what about cocaine?
Cocaine use during pregnancy restricts blood flow to the placenta.
Okay.
And that deprives the baby of oxygen and nutrients. That can lead to growth restriction, preterm birth, developmental problems. It's not good.
No, it doesn't sound good. Well, and then opiates, which are unfortunately increasingly misused, even in the form of prescription medications.
Right. And the biggest concern with opiates is neonatal abstinence syndrome, or NAS.
Okay, and remind us, what is that?
So basically, the baby goes through withdrawal after birth. They experience tremors, they're irritable, they have trouble feeding. It's really rough.
Yeah, so these are all really, really important things for us to keep in mind.
They are.
What are some of the key takeaways then, for nurses who are working with women who might be struggling with substance use during pregnancy?
It boils down to compassionate, non-judgmental care. We got to create a safe space for these women, offer accurate information without shaming them and help them get connected with treatment and support services.
Right.
Recovery is possible, but it has to start with understanding and empathy.
That's a really good point. It's not about judging. It's not about shaming.
Right.
It's about meeting people where they are.
Exactly.
Offering support.
Exactly. It's amazing how much we've covered already. And we've only just scratched the surface. It's incredible how many different things nurses have to be ready for in maternal care.
It really is.
Yeah.
Right. We've talked about a lot of these underlying conditions and stuff, but what about just pregnancy itself?
Yeah.
Things that just make it harder. Just those unexpected twists and turns.
Yeah, those are the things that can really catch you off guard. Pregnancy can throw some real curveballs.
It definitely can.
Right.
So what about what's that, hyperemesis gravidarum?
Oh, yeah, that's a rough one.
That's way beyond morning sickness.
It is. Think of it like morning sickness on steroids.
Right.
We're talking about severe debilitating vomiting,
Okay.
dehydration. Women end up needing to be hospitalized sometimes.
That sounds just awful. So what's the top priority for nurses when we're caring for women who are going through that?
It's all about hydration, making sure they're getting enough fluids and that their electrolytes are balanced.
Right.
We're often talking about IV fluids, medications to help control the nausea and vomiting. But beyond that, remember, these women are absolutely miserable. So they need emotional support too, reassurance. Yeah. This condition can be really isolating, so just letting them know that they're not alone, that it's going to be okay.
Yeah, so it's not just about the physical symptoms, but the emotional side too.
Exactly. It's all connected.
Okay, great. Well, let's talk about something else that I think is really, really important for nurses to understand, and it kind of has to do with blood types. And that's Rh incompatibility.
Oh, yeah. That's a classic example of how, these little biological differences can have these really big consequences. So basically, if a pregnant woman is Rh negative and her baby is Rh positive, her immune system can see the baby's blood as foreign.
Okay.
And start producing antibodies to attack it.
It's like a mismatch, right?
Yeah, they don't belong together.
And what happens, what's the impact on the baby?
Well, if it's not treated, those antibodies can actually cross the placenta and start destroying the baby's red blood cells.
Oh, gosh.
So that can lead to fetal anemia, jaundice. In severe cases, it can even be life-threatening.
So it's really, really serious. But I remember reading that there's a way to prevent it, right?
There is.
Some kind of injection?
Yeah. It's called RhoJam, or Rh immunoglobulin.
Okay.
And it's given to Rh negative moms during pregnancy and after childbirth.
Okay.
And it basically prevents those harmful antibodies from forming.
Wow, it's amazing what, medical science can do these days.
It really is. It's pretty incredible.
Okay, so let's talk about labor and delivery.
Okay.
Because, sometimes a vaginal birth, it's not always possible,
Okay.
right? Or it can be a lot more complicated.
Definitely.
So what about women who have had a C-section before? Can they still try for a vaginal birth?
They can. It's called a VBAC, or vaginal birth after cesarean.
Okay.
And, a lot of women are able to do it successfully.
Yeah.
But it's not a decision to be taken lightly, There are risks.
Like what?
Well, the biggest concern is uterine rupture.
Oh, okay.
Which is where the scar from the previous C-section tears during labor.
Oh, wow. Okay, so it's really about weighing those risks and benefits, right?
Absolutely. And also considering the woman's preferences, of course.
Right, what they want.
Exactly.
Okay. What about situations where the baby's just not head down?
Ah, yes, breech babies.
Yeah, the stubborn ones.
They like to keep us on our toes.
Mhm.
So a breech presentation means the baby's feet or bottom are down instead of their head,
Okay.
and that can make labor harder and increase the risk of problems.
For the baby or the mom?
Usually for the baby.
Okay, so what do we do in those cases?
Well, sometimes we can try to turn the baby from the outside. It's called an external cephalic version,
Okay.
but it doesn't always work.
Yeah.
So the decision about what to do next really depends on a lot of things. The baby's position, the mom's health, the experience of the doctor or midwife.
So you need a really good team, a lot of communication.
Absolutely.
Okay, so another labor complication that I've always found a little bit nerve-wracking is shoulder dystocia.
Yeah, that's definitely a scary one.
So remind me what that is again.
So it's when the baby's shoulder gets stuck behind the mom's pubic bone after the head is delivered.
Okay.
It's rare, but it's serious.
And what are the things that can happen if it's not taken care of quickly?
Well, for the baby, there's a risk of nerve damage in the shoulder and arm, and also oxygen deprivation if the umbilical cord gets compressed.
Oh, gosh.
For the mom, there's a risk of, excessive bleeding and tearing.
Wow, that's a lot. Okay. Well, so we've talked about labor and delivery.
Right.
What about, like, after the baby's born? The postpartum period?
The fun doesn't stop there.
No, I know. I mean, that can be just as wild in a different way.
It definitely is. Postpartum hemorrhage or bleeding after delivery, that's a big concern.
Yeah, that can be really scary. So what are the things that, like, as nurses we're looking for? Like, how do we know if something's, like, not right?
So think about it. If a woman is soaking through a pad in like an hour or less, that's a huge red flag. Other things to watch for are, a rapid heart rate, low blood pressure, dizziness, paleness.
Okay.
And it's important to check the uterus. If it's not firm, that's another sign that something's wrong.
So really just, like, being aware of all those subtle changes.
Exactly. We can't wait for things to get really bad.
Okay, yeah. Proactive, not reactive.
Exactly.
Okay, and then what about infections? Are those a big concern postpartum?
Definitely. Postpartum infections can happen in the uterus, the bladder, or even in the C-section incision.
Oh, wow. Okay, so, like, what are the things that can increase that risk of infection?
So a long labor, if the membranes rupture early, a C-section delivery, and any kind of trauma or instrumentation during labor.
Okay, so again, just being really vigilant, really aware.
Yep.
What are the signs, like the red flags that we should be looking for?
Fever, chills, abdominal pain, any kind of foul-smelling discharge, pain, or redness at the incision site.
Okay.
Basically anything that just doesn't seem right.
Okay, so again, early detection is key.
Absolutely.
Okay, cool. Well, let's talk about preterm labor and birth.
Yeah.
Because that's a topic that I think can be just filled with anxiety for both, the parents.
Oh, for sure. It's a scary thing to think about.
Yeah, so remind us, what is preterm labor exactly?
So it's labor that starts before 37 weeks of pregnancy.
Okay.
And it's actually a major cause of infant mortality and morbidity. Babies born prematurely, they're at higher risk for all sorts of problems, breathing problems, feeding problems, developmental delays, long-term health issues.
Wow, so it can have a really, really big impact.
It can. It's not something to take lightly.
What are some of the things that can actually cause preterm labor?
Well, it's complicated. There's not always one clear answer.
Okay.
Some women, they have a history of preterm birth. Others might be carrying multiples. Certain medical conditions like infections or preeclampsia can increase the risk. And even social and environmental factors like stress or poverty can play a role.
It sounds like a lot of things.
It really is. It's a whole web of factors.
So what can we do then to help prevent preterm labor? Or is it just, like, kind of out of our hands?
We can't prevent every preterm birth, but we can definitely try to reduce the risk. So early and regular prenatal care is really, really important.
Okay.
Managing any underlying medical conditions, that's huge. And lifestyle choices like not smoking, not drinking alcohol, those can make a difference too.
So it's like a combination of a lot of things and sometimes just, luck of the draw.
Unfortunately, yeah.
Okay. Well, what if preterm labor does happen? Like, what are the things that we might do?
It depends on how far along the pregnancy is and how serious the situation is.
Okay.
Sometimes bed rest and medication to stop the contractions might be enough.
Okay.
Other times, if the baby's really premature or if there are signs that the baby's in distress, delivery might be the safest option.
Even if it's early.
Even if it's early, yeah. And that means the baby might need to spend some time in the NICU.
Right. Okay.
Yeah.
Well, let's talk a little bit more about gestational diabetes, because I know that's something that can come up. And I think we touched on it briefly earlier, but I'd love to hear a little bit more.
Sure. So gestational diabetes is a type of diabetes that develops during pregnancy, usually later on in the second or third trimester. It happens when the body can't make enough insulin to keep up with the demands of pregnancy.
Okay.
And I know we talked about how it can have some serious consequences.
Yeah. So remind us, why is it so concerning? Why do we need to be so careful about it?
Well, when a woman has gestational diabetes, her blood sugar levels can get too high, and that can cause the baby to grow too large.
Okay.
And that can make delivery more difficult and increase the risk of complications for both mom and baby.
Oh, wow.
It can also increase the baby's risk of having low blood sugar after birth,
Okay.
and even developing obesity or type 2 diabetes later in life.
So it can have these long-term effects.
Exactly. It's not just a pregnancy issue.
Wow. Okay, so what are the main things that we can do to manage gestational diabetes?
Well, the first line of defense is usually lifestyle changes, eating a healthy diet, getting regular exercise, and monitoring blood sugar carefully.
Okay.
Sometimes, though, medication is needed, usually insulin, to keep those blood sugar levels in a safe range.
And how do we typically know, how do we diagnose gestational diabetes?
So we usually screen all pregnant women for gestational diabetes somewhere between 24 and 28 weeks of pregnancy.
Okay.
And the screening it's pretty simple. They drink a sugary drink, and then we check their blood sugar levels.
Okay.
And if those levels are high, then that might mean they have gestational diabetes.
So routine screening again
Absolutely. It's so important.
can really make a big difference.
Huge difference.
Okay, great. Well, let's talk about another condition that can happen during pregnancy that can be really serious, and that's preeclampsia.
Okay, yeah.
So what is preeclampsia, and what are the warning signs? What are the things that we need to be looking for?
So preeclampsia is a condition that can develop after 20 weeks of pregnancy.
Okay.
And it involves high blood pressure and protein in the urine.
Okay.
And it can be really dangerous.
It's life-threatening.
Yeah, it can be. So the things to watch for are severe headaches, vision changes, swelling in the hands and face, sudden weight gain, basically any of those things that just don't seem quite right.
Yeah, but those are all things that can happen normally during pregnancy.
Oh, that's why it's so tricky.
Yeah. So how do we know as nurses what's normal and what's a red flag?
It's all about paying attention to the details,
Okay.
asking the right questions, and never dismissing a woman's concerns.
Okay.
If something feels off, it's always better to be safe than sorry and check with the doctor.
Yeah, good communication is so important.
Absolutely. And trust your gut,
Yeah, that nursing intuition.
Exactly.
Okay, so how do we actually manage preeclampsia then? What are the things that we do?
The only cure for preeclampsia is delivering the baby. But the timing of that delivery really depends on how severe the preeclampsia is and how far along the pregnancy is.
Okay.
If the baby's not mature enough to be delivered yet, then we might try to manage it with close monitoring, bed rest, medication to control the blood pressure.
Okay.
Just trying to buy the baby some more time in the womb.
Right.
But if it's really severe,
Yeah.
and either mom or baby are in danger, then delivery might be necessary, even if the baby's very premature.
So it's a tough decision,
It is. It's a balancing act.
Okay. Well, I think it's important that we also talk about pregnancy loss.
Yeah.
Because, even with the best care, sometimes things just don't go as planned.
Yeah.
And this is a really tough topic, but it's something that as nurses, we need to be prepared to deal with.
Absolutely. Pregnancy loss is a devastating experience, and it's more common than many people realize.
Yeah. So, what are the different types of pregnancy loss?
Well, there's miscarriage, which is the loss of a pregnancy before 20 weeks. And that's actually incredibly common.
Really?
Yeah, it often happens so early that a woman might not even know she's pregnant.
Oh, wow.
Then there's stillbirth, which is the loss of a pregnancy after 20 weeks.
Okay.
And then there's ectopic pregnancy, which is when the fertilized egg implants outside the uterus, usually in a fallopian tube.
Okay.
And that can be really dangerous for the mother.
Wow. Okay. So what are some things that, as nurses, we should remember when we're caring for a woman who's experienced pregnancy loss?
I think the most important thing is to acknowledge the loss.
Okay.
Don't shy away from it. Don't minimize their pain.
Right.
Just offer sincere condolences, listen with empathy, and validate their feelings. There's no right or wrong way to grieve,
Yeah.
so we just need to provide support without judgment.
So be present with them.
Exactly.
In their grief.
Exactly. And, remember that there are often physical aspects of care that we need to address as well.
Okay, like what?
Well, depending on the type of loss and how far along the pregnancy was, a woman might need help with pain management or bleeding control.
Okay.
And we need to be sensitive to the fact that, their bodies are still going through all those hormonal changes, even though the pregnancy has ended.
Right. So it's really a multifaceted experience that we have to be sensitive to.
Absolutely.
Okay. Well, let's shift gears again and talk about a topic that, often has a lot of cultural sensitivities around it, and that's female genital mutilation, or FGM.
Yeah, that's a tough one.
It is. So can you just remind us what FGM is again?
So FGM is a harmful traditional practice that involves, the partial or total removal of the external female genitalia.
Okay.
And it can have some really serious physical and psychological consequences. It's a human rights violation, really.
It's hard to believe that that's still happening in different parts of the world.
I know. It's really difficult to wrap your head around.
So for nurses who are caring for a woman who has undergone FGM, what are some things that we need to keep in mind?
Cultural sensitivity is really, really important.
Okay.
We need to approach these women with understanding and respect.
Yeah.
Recognizing that FGM is often deeply rooted in their culture. And we also need to be aware of the potential physical complications.
Okay, like what?
Things like chronic pain, infections, difficulty with urination, childbirth. It can really impact their lives in a lot of ways.
Wow, okay. So it's really about, addressing both the physical and the emotional needs.
Exactly. And being mindful of that cultural context.
Okay, that makes sense. Well, let's talk about contraception because, that's such an important part of promoting reproductive health for women.
Absolutely. Contraception or birth control is all about empowering women, giving them the ability to make informed decisions about their bodies and their reproductive health.
Right, yeah. So what are, the main things that we need to think about when we're discussing contraception with our patients?
Individualized care is so important here. What works for one woman might not work for another.
Right.
We need to think about their medical history, their lifestyle, their preferences, even their cultural and religious beliefs. It's not a one-size-fits-all thing.
And what about women with certain medical conditions? Does that affect their options?
Definitely. Some medical conditions can make certain types of contraception unsafe or less effective.
Oh, yeah.
For example, women who have a history of blood clots, they might need to avoid estrogen-containing methods like the pill or the patch. And some types of migraines can be a concern with hormonal contraception as well.
So there's a lot to think about.
There really is. It's about finding that perfect match.
Right, and helping them navigate all those different options.
Exactly.
Well, let's talk about a topic that can be really difficult to address, but it's so, so important for patient safety and well-being, and that's sexual assault and abuse.
Yeah, that's a tough one.
It is. It's hard to even think about. But sadly, it's more common than we like to think.
Well, unfortunately, yeah.
And, as nurses, we need to be prepared to care for these patients in a way that's both compassionate and competent.
Absolutely. We have to approach these situations with so much sensitivity.
Yeah. So what are some of the most important things to remember when we're caring for a woman who's experienced sexual assault?
First and foremost, create a safe and supportive environment. Let her know that you believe her and that you're there to help.
Okay.
Make sure her privacy and confidentiality are protected. Be mindful of her emotional state. And don't pressure her to talk about the assault if she's not ready.
Right, yeah.
It's about letting her lead the way.
What about, the physical aspects of care? Are there things that we need to be aware of?
Absolutely. We need to check for and treat any injuries, of course.
Yeah.
We also need to offer preventative treatment for sexually transmitted infections and give her information about emergency contraception if she requests it.
Okay, so really addressing both the physical and the emotional trauma.
Exactly. It's about providing holistic care.
Okay. Well, let's talk about gender identity and sexual orientation.
Yeah.
Because, as healthcare providers, it's so important that we create an environment that's welcoming and inclusive for everyone, regardless of who they are or who they love.
Absolutely. Everyone deserves to feel safe and respected in a healthcare setting.
Right. So what are some practical steps that nurses can take to be more inclusive in their practice?
It starts with language. using inclusive language, asking patients about their preferred pronouns.
Okay.
We need to avoid making assumptions about people's sexual orientation or gender identity based on their appearance or who they're with.
Right.
And we need to educate ourselves about the unique health needs of LGBTQ+ individuals and advocate for policies and practices that promote equity and access to care for everyone.
Yeah, it's about recognizing that healthcare is a human right, not a privilege.
Exactly.
Okay, well, let's talk about mental health, because, that's such a huge part of overall well-being.
It really is. And it's especially important during the perinatal period, pregnancy and postpartum. It can be a really emotional time.
Yeah.
And a lot of women experience anxiety, depression, even more serious mental health conditions.
So what are the signs and symptoms that we as nurses need to be watching for? Like, how do we know if something's not right?
So things like excessive worry, sadness, fatigue, changes in sleep or appetite, having trouble bonding with the baby, and of course, any thoughts of harming themselves or the baby.
Okay.
Those are all red flags that we need to take seriously.
Right, because even though it's supposed to be this happy time, those mental health challenges can still happen.
They can, and we need to be ready to support women who are going through that.
So what are some of the resources and support services that we can connect women with?
Well, there's therapy, support groups, medication, even respite care can be really helpful.
Okay.
The main thing is that women know that seeking help is a sign of strength, not weakness, and that recovery is possible.
Right, so it's important to get that message across.
Absolutely.
Okay, well, let's shift gears a little bit and talk about something that is really changing the face of healthcare, and that's genetics.
Yeah, genetics is fascinating.
It is.
It's like the instruction manual for our bodies, and we're learning so much about it all the time. And those advances in genetic testing have really opened up a lot of possibilities for understanding and managing health conditions, even during pregnancy.
Yeah, so can you give us some examples of genetic conditions that might be relevant during pregnancy?
Sure. So cystic fibrosis, sickle cell anemia, Tay-Sachs disease, those are just a few examples. And genetic testing can help us identify people who carry these genes, and it can give couples information about their risks of having a child with one of these conditions.
It really helps people make those decisions about family planning.
Exactly. It's about empowering people with information so they can make informed choices.
Okay, that makes sense. Well, what about a topic that, can be really scary during pregnancy, and that's cancer?
Yeah, that's a tough one.
It is. It's difficult enough to deal with a cancer diagnosis at any time.
Right.
But then when you add pregnancy into the mix,
It just adds a whole other layer of complexity.
it really does.
Yeah.
So what are some of the things that we need to think about when we're talking about treating cancer during pregnancy?
Well, the main goal is to find a balance, right?
Yeah.
The best possible treatment for the mom, but also keeping the baby safe and healthy. Some treatments, like chemotherapy and radiation, can be really risky for the developing fetus, especially early on in the pregnancy.
So those decisions are really, really tough.
They are. It's a delicate balance.
Okay, well, let's talk about infertility,
Okay.
because, that's something that affects a lot of couples.
Yeah.
And it can be a really emotional and challenging experience.
It can. It can be really tough. So infertility is basically defined as not being able to get pregnant after a year of trying.
Right.
And it can be really stressful and emotionally draining. It can put a strain on relationships.
Yeah.
And just make people feel, like they've lost control.
Right. So what are some of the common things that can cause infertility?
Well, there are a lot of possibilities.
Yeah.
Problems with ovulation, blocked fallopian tubes, low sperm count. Sometimes it's a combination of factors. And sometimes, even with all the tests we have, we can't find the exact cause.
And that's got to be frustrating.
It's really frustrating for both the couples and for us as providers.
Yeah, because you want to be able to help.
Exactly.
Okay, well, so what are some of the things that we can do to treat infertility? What are the options?
Well, it really depends on what the underlying cause is.
Okay.
Sometimes simple things like lifestyle changes or medications can help.
Okay.
Other times we need to use assisted reproductive technologies like IVF, in vitro fertilization.
Okay.
It really depends on the individual situation.
So it's a very individualized approach.
It is.
Okay. Well, let's talk about perinatal loss, because, this is a topic that's often really hard to talk about. But it's so important that we as nurses are prepared to support families who are going through this.
Absolutely. Perinatal loss, it encompasses the loss of a baby during pregnancy or shortly after birth.
Okay.
And it's just a devastating experience for everyone involved. It can have such a lasting impact.
Yeah. So as nurses, what are some of the things that we can do to help these families cope?
I think the most important thing is to let them grieve in their own way and at their own pace. Don't rush them. Don't try to offer easy answers. Just listen. Validate their feelings and let them know that it's okay to feel whatever they're feeling.
So be present.
Yeah, just be present. And remember that there's no timeline for grief.
Right. Okay. Well, let's talk about a topic that can be really emotionally charged and ethically complex, and that's termination of pregnancy.
Yeah, that's a big one.
So, this is a really personal decision for women, and there are so many factors that go into it.
Absolutely. And it's important to remember that as nurses, our role is to provide care and support regardless of a woman's decision.
Right. So we're not there to judge.
Exactly. We're there to provide information, answer questions, and make sure that women feel safe and supported throughout the process.
Okay. So let's talk about prenatal care.
Okay. Yeah.
Because, prenatal care, it's like the foundation for a healthy pregnancy, right?
It really is. Think of it as preventative health care for both mom and baby.
Okay. So what are the main things that are included in prenatal care? What are the things that we should be educating our patients about?
It's really a holistic approach. So we're talking about regular blood pressure checks, urine tests to screen for protein and infections, blood tests for things like anemia, ultrasounds to monitor the baby's growth.
Okay.
We also do screenings for things like gestational diabetes and preeclampsia, which we talked about earlier.
Right.
It's really about catching any potential problems early on.
Yeah, okay. And what about education? Like, what are some key things that we should be discussing with our patients?
Education is a huge part of prenatal care. We talk about all the healthy pregnancy habits like nutrition, exercise, avoiding things like alcohol and tobacco.
Right.
We also talk about preparing for labor and delivery, breastfeeding, newborn care. Just trying to give women the tools and information they need to have a healthy pregnancy and feel confident as new parents.
Okay, so we're setting them up for success.
Exactly.
Okay, cool. Well,
It's amazing, isn't it, how much genetics plays a role in all of this.
yeah, it's pretty incredible. And you know what? Speaking of being proactive, I wanted to touch on preconception counseling.
Oh, yeah, that's such a valuable tool.
Because it's like you're planning for a pregnancy before it even happens.
Exactly. It's all about optimizing health and reducing risks, before conception, being proactive rather than reactive.
Okay, so what kind of stuff do you typically talk about during preconception counseling?
Well, it runs the gamut. We talk about vaccinations, managing any chronic conditions like diabetes or hypertension. We talk about nutrition, exercise, the importance of avoiding alcohol and tobacco. It's really a chance to identify any potential red flags and get things in order before pregnancy even begins.
So it's like a holistic health checkup, but with a focus on the future.
Exactly. It's about setting the stage for a healthy pregnancy.
Okay, I see. Well, I wanted to switch gears a little bit and talk about something that, no parent wants to think about, but it's something that we need to be aware of, and that's sudden infant death syndrome, or SIDs.
Yeah, that's a tough one.
It is. So remind me, what is SIDs exactly?
So SIDs is the sudden, unexpected death of an infant, usually under a year old.
Okay.
And it's tragic. We don't know exactly what causes it, but there are some things that we know increase the risk.
Like what?
Well, sleeping on the stomach is a big one.
Yeah.
So babies should always be put to sleep on their back.
Back to sleep.
Back to sleep.
Right.
And exposure to secondhand smoke, that's another big risk factor.
Yeah.
And prematurity. Babies born prematurely are also at higher risk.
So those are all things that we can educate parents about.
Exactly. And there are things that parents can do to create a safe sleep environment for their babies.
Okay, like what? What are some of the recommendations?
The ABCs of safe sleep are a good place to start.
Okay, remind us what those are.
Alone on their back and in a crib.
Okay, so no bed sharing.
Right. No bed sharing. And no soft bedding or toys in the crib.
Yeah.
And of course, a smoke-free environment.
Okay, so those are all really important things for us to emphasize to parents.
They are. It can make a big difference.
Yeah, okay. Well, another topic that no parent wants to think about is childhood cancer.
Yeah, that's a really tough one.
It is. And, the diagnosis itself is devastating, but the treatment can be really intense, too.
It can. It's a long road.
But thankfully, we've made a lot of progress in treating childhood cancers.
And survival rates have really improved for many types.
That's good to hear. So what are some of the more common types of childhood cancers that we might see as nurses?
Leukemia, lymphoma, brain tumors, bone cancers, those are some of the ones that we see more often.
And as nurses, what are some of the key things that we need to keep in mind when we're caring for a child with cancer?
Well, first and foremost, compassionate care. Always.
Right.
These kids are going through so much. They need someone to be their advocate, to help manage their pain and all the side effects of treatment, and to support them emotionally.
So it's about treating the whole child.
Exactly. Not just the disease.
Okay, well, let's switch gears and talk about, I think, one of the greatest public health achievements of all time, and that's immunizations.
Oh, absolutely. Vaccines are amazing. They've saved so many lives.
They have. So can you give us a rundown of some of the common childhood vaccines that nurses should be familiar with?
Okay, so there's measles, mumps, rubella, polio, diphtheria, tetanus, pertussis, chickenpox. That's just to name a few.
And why are they so important? Like, how do they actually work?
Vaccines work by basically introducing a weakened or inactive version of a germ into the body.
Okay.
So it triggers the immune system to create antibodies
Okay.
without actually causing the disease. So the body learns how to fight off that particular germ without getting sick.
So it's like a training exercise for the immune system.
Exactly. It's like boot camp for your immune cells.
I like that. Okay. Well, another thing that we have to be ready for as nurses is pediatric emergencies.
Yeah, those are always stressful.
They are. But as nurses, we got to be able to think on our feet. We got to stay calm, and we got to be able to reassure those parents who are understandably freaking out.
Absolutely. It's a delicate balance.
So what are some of the more common pediatric emergencies that we might encounter?
Well, choking is a big one. Seizures, allergic reactions, asthma attacks, trauma. Those are all things that can happen pretty suddenly.
Yeah, and they can be really scary. So what are some key things to remember when we're responding to a pediatric emergency?
First, stay calm. Easier said than done, I know, but it's important.
Right.
Assess the situation quickly, initiate the right interventions, and keep those parents informed.
Okay.
Communication is so crucial in those situations.
Yeah, because they're looking to us, for that guidance.
Exactly. We need to be a source of both expertise and comfort.
Okay, great. Well, let's talk about childhood obesity. Yeah. This is a growing problem, right?
It is, unfortunately.
Right.
And it's not just a cosmetic issue. It can have serious health consequences.
Right. So it's not just about like willpower or anything like that. There's a lot more to it.
Mm-hmm.
So what are some of the factors that contribute to childhood obesity?
Well, think about our environment.
Okay.
We have sedentary lifestyles, easy access to processed foods, sugary drinks, and there's also a genetic component.
So it's like a combination of a lot of things.
It is. It's complex.
So how can we, like as a society, but also as healthcare providers, how can we start to address this?
Well, we need to start promoting healthy lifestyles early on.
Mm-hmm.
Encourage physical activity, make healthy foods more available and affordable.
Right.
And we also need to address some of the underlying social and economic factors that contribute to obesity.
It's a big picture issue.
It is. It's not a simple fix.
Okay, so another population that I think is really important to talk about is children with special needs.
Yeah, those kiddos and their families often need a lot of extra support.
They do, and their needs are so diverse, right?
Absolutely. We're talking about kids with physical disabilities, developmental delays, learning disabilities, behavioral challenges. Every child is different, so the care we provide has to be individualized.
Right, and what are some of the challenges that families might be facing? Like, what are the things that we need to be aware of as nurses?
Well, think about navigating the healthcare system. It can be really complicated.
Yeah.
Finding the right therapies, the right educational services, and just the day-to-day challenges of caring for a child with special needs.
Right.
It can be exhausting, both emotionally and financially.
Yeah, so we really need to be advocates for these families.
We
right?
do. We need to connect them with resources, offer support, and just be understanding. Parenting a child with special needs is a really unique experience. It can be incredibly rewarding, but it can also be incredibly challenging.
Yeah.
So these families need our compassion and support.
Yeah, it's about seeing the whole family, right? Not just the child.
Exactly. It's about recognizing their strengths and their struggles and meeting them where they are.
Yeah, love that. So I think that's a really good place to wrap things up. We've covered so much ground today. It's been a really amazing conversation.
It really has. I always learn something new from these deep dives.
Me too.
Yeah.
And, I think the biggest takeaway for me is just how complex and challenging and rewarding nursing can be. It's a profession that truly touches every aspect of human life.
That's so true. It's a privilege to be a part of this profession.
Yeah, it really is. So to all you aspiring nurses out there, get ready. You're in for an amazing ride. You're going to be challenged. You're going to learn so much, and you're going to make a difference in people's lives every single day.
And never stop learning. The world of healthcare is always changing, so stay curious, stay engaged, and keep striving to be the best nurses you can be.
That's great advice. And to everyone listening, thank you so much for joining us for this deep dive. We'll see you next time for another exploration of the world around us.